guys, this is Tyler with Southern California EMS Training Institute. Today we're going to talk about in this video what is blood pressure and why do we check for it. First off, what is blood pressure? So we've already talked a little bit about how to either auscultate or how to palpate a blood pressure, but what does all that mean, right? So what is the blood pressure? Well, blood pressure is actually the pressure that is exerted against the walls of the arteries, right? So your arteries are all the blood vessels that go away from your heart. They're typically your thicker blood vessels, and they have a high pressure actually inside of them, right? So your blood pressure is the force that's exerted on the walls of the arteries. And we actually check it at two different times, right? So we have a systolic number and then a diastolic number. Your systolic number is always the number on the top of your blood pressure. For instance, if we were to have a blood pressure of 120/80, right, the 120 would be your systolic number. Now, systole literally means to contract, right? So in this situation, what we're talking about is the systolic blood pressure is the pressure that's exerted on the walls of the artery when your heart contracts. Your heart has two phases to it. It's either contracting or it's resting. It's contracting or it's resting. Right? Your heart is a muscle, it's a pump, that's all it does. So it pumps blood again and again and again and again. So first, right, when we get that first number on our blood pressure, that top number, right, that's our systolic blood pressure, the pressure that's exerted on the forces of the walls of my arteries when my heart contracts. The diastolic is obviously the opposite then. Diastolic is the lower number. Again, it's the last beat that we hear when we're listening to it with our stethoscope. And the diastolic is the pressure that's exerted on the walls of the artery when my heart's resting. Those periods in between beats, right? Again, it beats, it rests, beats, and it rests, and so on and so forth. So that diastolic blood pressure is really good and is really important for us to get as well because it tells us the pressure that's exerted on the walls of the arteries when my heart is at rest. Now, blood pressure is important. It kind of gives us an idea of circulation, right? Typically, we assess a blood pressure in the patient's upper arm, right? And for instance, I would be assessing my patient's blood pressure in their left brachial artery, right? And I'm assuming it's the same all over the body. Right? But we could take blood pressures on the legs, on the right arm, on the left arm, and it might be different in those different spots, right? Because we're assuming that it's the same all over the body. Now again, it's important that we get both of those numbers. The systolic number tells me a little bit about how hard the heart's working and how well the heart is functioning, where the diastolic number tells me a little bit more about the blood vessels and maybe how well they're contracting and their tone at that time. So that's what we're going to look for, you guys. I know that's a pretty in-depth look at blood pressure, but it's really important that we assess patients' blood pressure. It gives us an overall picture of their circulation and how well they're perfusing or getting oxygen, glucose, and nutrients to their tissues and getting rid of those waste products. Lastly, normal ranges for an adult, right? A normal range for an adult is 120/80, right? That's a normal blood pressure for an adult. The low side of that, what we call hypotensive or hypotension, is going to be anything that's 90/60 or 90 systolic with a diastolic of 60 millimeters of mercury. And then our hypertensive or high blood pressure is considered anything over 140/90. Those are your adult ranges. Typically, we want to see a patient's blood pressure at least lower than 140 and higher than 90 on that systolic number, but typically a normal healthy blood pressure should be around 120/80. This is Tyler from Southern California EMS Training Institute. Thank you guys very much.